Hi everyone, I'm Dr. Amir Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation surgeries. So what that means is I perform lots and lots of facelifts, fat transfers, eyelid surgeries, lip lifts, all the things that help people look as young as they feel. And a common question that comes up all the time is how long does it take to recover from a facelift? So you guys are in for a real treat because instead of explaining the ins and outs of recovery, I'm going to show you one of our patients. Her name is Ellen. She's 68 years old and she's an incredibly intelligent and thoughtful woman who runs a very successful menopause blog who helps women in this exact same age range dealing with this important life transition. And she wanted to give people the opportunity to get an inside view of what recovery looks like. And I think you guys are going to find this to be worth 10,000 words, what she's going to show us in her staged recovery photos and videos. It's rare to be able to see somebody go through the process at this kind of detail and see the stages like the way Ellen shared with us, but we hope to have more of these videos for you because I think the more you see, the better, because this journey, even though it was specific to Ellen, it will nevertheless give you a good idea of what healing looks like. And just to quickly review before we launch into her stages of recovery, let me start off by saying she had a vertical restore. She had her upper and lower eyelids done. She had a fat transfer done, and she had a full field laser resurfacing using the Contour TRL, which is an erbium YAG laser. Hope you enjoy it. And if you have any questions or comments, make sure you jot them down below. But I'll be with you in just a minute after the presentation.
Hi from Facelift Central. We're on day 4 and I'm a hot mess, mostly from the laser. I must tell you, it looks like it should hurt. It does not hurt. It does hurt to look at it. So I have not been looking at myself starting yesterday, which is great. You can get a little concerned and it can kick in oh my God. But I know that the swelling's gonna go down. I know that the face is gonna peel and I'm gonna have a great result.
I'm coming at you from the home of Ellen Dolgen. My name's Kelly Greatuck. I'm a plastic surgery recovery nurse. If you're following along, Ellen is sharing her facelift journey with us. Today is day 6. My question for you, Ellen, is why did you decide to have this facelift in the first place? And why are you sharing your journey with us?
Well, I have to say for about the past 10 years, I have been unhappy with my skin texture and also the wrinkling and sagging on the sides of my face. I tried to be okay with it. I really did. I thought, oh, Ellen, you're being shallow. I really had a lot of self-shame about not liking how I looked. Why am I not just completely grateful that I'm so healthy, which I am, completely grateful. But what I've learned as I grow older is that it's okay to feel what I feel. And somebody else is gonna feel something else, and that's fine too. I shamed people who wanted to have cosmetic surgery. I mean, I was guilty of the same thing because I was trying so hard to be okay with how I was aging, but I really wasn't. So when I finally came to grips with the whole thing, I was right before my 68th birthday, basically, this year, and I said to myself, you know what, for my birthday, I'm going to do this, and I'm gonna be fearless, and I'm gonna embrace vulnerability, and I am going to not only get this face rejuvenation, I'm going to be open and honest about my journey with other women in case I can help others. You should do what feels good in your heart. And sometimes that takes a while to figure out. But I figured it out. It was for me. It was not for anybody else. And for me, I knew this is the right thing to do. And then I started, on my journey. I'm embracing every step, even the yucky part. I don't expect to look like I'm 30. I just wanted to look like my best self at 68, basically, and feel that the outside sort of was similar to how I feel inside. I wish more people would share publicly, but I'm trying to break that conversation open a little more. I hope it's helpful to everybody. Even if I help one other woman, I'm gonna be happy.
What have you been eating, and what do you think are the most important things to eat after a facelift?
So I'm now a vegan. I've been a vegan for 11 weeks. I became a vegan because I went off my hormones at 68 years old and started having hot flashes. So the reason I went off my hormones is because I had genetic testing, and I did have a mutation that makes me twice as likely to have breast cancer. So I just, out of extreme caution, decided to go off my hormones. Being a vegan means you do a lot of prep, which worked great for the facelift because, I made chickpeas, I made my soybeans, I did a lot of prep beforehand in my slow cooker, soups, things that were really mushy. And that paid off because I wanted to eat really well. I want to make sure I have the nutrition to heal well. So I came home right away. Kelly made sure I ate something before I fell asleep, post-surgery, and so I could take my antibiotic. And I think it's paid off. I feel really strong, and I also feel like really healthy through this.
All right, so we are day 7 with Ellen. I just had a chance to look her over. Very little in the way of bruising, some discoloration that's normal and natural. Ellen, tell us a little bit about what the week was like for you.
Unbelievably easy. I am shocked. I have to say, first of all, I've been on Tylenol. I was on Tylenol for only 3 days. And then I really was great. And honestly, the Tylenol was more for the laser sunburn discomfort. And then that only lasted a few days, and then you're okay. And energy-wise, I have all my energy. I think part of it is the calmness of how you prepared me for this journey. Your packet is so detailed. And having me buy everything ahead.
A lot goes to your credit for actually following through, reading the packets, that kind of thing, because at the end of the day, there are videos or packets, but if somebody doesn't read them, they're not going to be as prepared. And taking that seriously and being prepared is a super important part of it. But also, I have to say your attitude about the whole thing, and I tell patients this all the time, the more laid back, relaxed you are about the upcoming process and the after, the post-op, the faster you heal, the less uncomfortable you are. All that, because I think when people stress about stuff, the cortisol levels go up, all that's, and then it really inevitably causes a delay in healing. And I see that all the time. When people really are stressing to heal as fast as they can, they usually take twice as long to heal. This next 7 days is going to be really, really fun to see, because that's when you're going to see daily changes going on.
Today is post-op day 7, and so I wanted to ask you today, when you look in the mirror, Ellen, what are you thinking, and how are you managing your mind about all this? And when you went to your post-op visit today, what did you ask Dr. Karam and his nurse about?
Okay, so I went in with a great list of questions, so I didn't forget anything. I wrote them all down. One of the big questions I have, which I'm sure everyone else is wondering too, what's up with the lip? And I asked the same thing. I said, it seems like this is super red. And anyhow, everybody reassured me this is the normal process, and not at all concerned about it. It's going to be great. So that was good. I asked questions like, now they took out the stitches, am I able to wash the side of my face? Because there is so much goop on your face, which is really important to keep moisturizing. And it was also on the stitches. But today I got to wash that goop off my hair. So that was exciting.
It's the little things.
It's the little things with baby shampoo, and it's still not putting water all over my face. So that I did very carefully in the shower with a handheld shower head.
And one thing I want to speak to just from the recovery side of things, I think it was day 2 or 3, one side of her face was a little bit more swollen than the other side of the face, totally normal. These incisions don't know what these incisions are doing. Our faces do not heal symmetrically.
Hey, Mom.
Hi.
So excited to see you on day 11.
I know.
Post-op.
The redness is calming every day. The bruising is going through its yellow stage, but it's getting less and less.
Yeah, a lot less yellow today.
Today, I don't have to do the vinegar soaks anymore.
Yay.
I'm on a Cetaphil wash and a Cetaphil moisturizing lotion.
So how many times a day are you doing that?
Only twice.
So kind of like a normal day where you wash your face and put on lotion twice a day.
Exactly. Good morning, day 13 from Facelift Central. Every day there's new healing. The redness is getting better and better, and the swelling is coming down a little, so all part of the progress. I did want to clarify something that was brought to my attention. I did not receive a free facelift, nor did I ask for a discount to speak about my journey. I am a women's health menopause awareness advocate. If you go to ellendolgen.com, you will see what I've been doing for the past 13 years is really breaking open the conversation about menopause and helping to support other women through their journey. I interview doctors and specialists from all over the United States, and I deliver the message in layperson speak in my trademarked Menopause Mondays blog. If you aren't a subscriber, go subscribe to it at ellendolgen.com. The reason I wanted to talk about my journey through cosmetic surgery is because I sort of felt it was similar to my menopause journey. I did ask Dr. Karam if it was okay with him if I posted the day-to-day experience, because most of what you see on the internet is the before and after. But I really wanted to give women a real experience of what my journey is. And I always think the more information I have, the more prepared I am. And he was very sweet about it. And he said, absolutely think it's a great idea.
Hi everybody, I'm Ellen's daughter, Sarah, and I came over to check on my mommy and see how she's doing post-op, day 16 from her facelift and laser. Well, your face looks awesome.
Every day.
Every day is just like a huge transformation. One thing I want to say though, is you look like yourself. You don't look, which is a good thing, you don't look like different. I mean, I'm looking at my mom. It's just that you already look so much younger. I can see major changes. It's really awesome. But I'm happy that you look like you.
Me too.
As your daughter.
Yes, and
I was just saying.
Yeah, the redness is coming down. I still have redness. I could have put makeup on today, but I just decided to really help other people see the journey, why would I do that? So you can see I'm still red. I have a few little blotches of a little rashy thing that I got from the Aquaphor, but it's clearing up, and everything is going just as he said, actually. Hello, it's Saturday, day 18 from Facelift Central. I'm just getting ready to go out to have lunch with some friends outside, and so I've got my UV protection hat on. Got to protect my lasered skin. Anyway, every day I'm healing. I'm still red here because my skin is very sensitive, and also I think, he did a lot of work there on fine lines. But otherwise, every day is exciting. Good morning, it's Sunday on day 19 at Facelift Central. Many of you wanted to see my incisions, so I'm gonna try to do that. I put my hair up for you. The incisions start like right about here. They go down into the ear, also behind the ear, and a little bit into the hairline. Also, you wanted to see my side view, so there you go. My neck is amazing. You are numb. I mean, I'm numb on the neck, and I'm numb like right about here. The rest of my face I can feel just fine, and I can move it just fine, no problem. I understand the numbness goes away at different times for different people, and it's fine with me. I'm okay with it. It's not like you're touching your face all day, so you don't even notice it. And other than that, I'm really excited every day with the changes.
So we are here for our next appointment. We're 4 weeks out with Ellen.
I toyed with wearing makeup today, but then I thought I just want to be real. I want people to continue to see the real journey. When I put on makeup, you can't see, this is maybe a little bit red still, but my lip looks amazing now. I wanted to feel the same outside as I do inside, and you rejuvenated me outside, and I just feel like I match now. And everyone who sees me, including my husband, can't stop staring at me because their biggest compliment is, Ellen, you look just like you, only you look so rejuvenated and rested, and they're astounded. And that's your talent. That you didn't change me. I'm so glad I did the laser. It looks painful, but it really was like a bad sunburn. And I don't want women to be scared because it is so worth it. And I'm so glad you told me you wanted me to do it. And I just trusted you in every way. I'm so glad I did my eyes. I was nervous about that. I mean, your staff is unbelievable, and everybody is there for you when you maybe feel a little vulnerable, and you just can call and they say, oh, that's where it's supposed to look or whatever. And so I just want to tell women, don't be afraid. I was really afraid for a long time. It's been the most amazing feeling to just want to smile every day again. I hope that my journey will help you understand the real process, and you'll have the confidence to do what you want in your heart. Hi, I'm 7 weeks yesterday of a vertical restore, upper and lower bluff, and fat transfer, and a TRL laser. And I'm pretty excited.
All right, folks, so I hope you enjoyed watching Ellen's journey as she healed and recovered from her surgery. It's been such a pleasure taking care of her, and I feel so indebted to her for giving all of you the opportunity to really get into the intimate stages of her healing. But again, I think it's really, really important for you all to have a good idea, because the last thing I would want, or any other surgeon would want, is for you to think that you can go in surgery and out and be one of those amazing looking before and afters without having this sort of in-between stage. And trust me, when people are going through those in-between stages, especially that first week, it is normal to feel very, very, I hate to say it, but almost regretful and scared that you made the wrong choice, because you look at yourself and you're like, how is this ever going to look normal again? And again, if you got the right surgeon with the right procedures, you will recover beautifully. You will have a natural and beautiful looking outcome. Like any other procedure, do your homework. Make sure you're in the hands of a specialist who specializes in these type of procedures, because these are intricate and difficult procedures, and there's a big difference between those of us who do this regularly and do them often versus somebody who does them from time to time. And of course, we all have busy practices, but it's our decision what we choose to focus on. And in my particular case, I choose to focus on facial rejuvenations, and cases like Ellen are stuff that I do every single day for our patients. Again, hope you enjoyed this healing journey. Please make sure that you jot down any questions that you have in the comments, or just let me know what you thought of the video. If you're not already subscribed, make sure you subscribe to this channel. I'm going to have videos like this across the entire topic of facial and skin rejuvenation. We post once or twice a week, so a lot of good stuff coming your way. And finally, make sure you like it, share it. There'll be more of this to come. So again, my pleasure, and look forward to sharing more with you. Thanks again, Dr. Amir Karam.
But it's absolute.